Welcome and thank you for joining us for tonight's webinar on using HealthLink SmartForms and SR Specialist and Referrals in best practice. My name is Bradley and I'm a Digital Health Officer here at Central and Eastern Sydney PHN, and I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water and community, and pay respect to elders past, present and emerging. I also extend that respect to any Aboriginal colleagues who may be joining us today. So this session is hosted by SR Referrals, and our speaker today who will take us through the SmartForms is Eric Dunn, who's the clinical liaison. And we also have Dr. Carmel Cervin from this SR Specialist and Referral Service. So welcome, Eric and Carmel.
My name's Eric Dunn. I'm the presenter for this evening. And I also would like to begin by acknowledging the traditional custodians of the land on which we meet and pay my respects to the elders past, present. And I extend that respect to Aboriginal and Torres Strait Islander people who may be on the call this evening. A quick bit about me. I've been in information technology for over 20 years, the last 8 in digital health, most recently 4 years as the digital health manager at the Sydney North Health Network, which is a primary health network. I now help specialists and GPs with e-referrals at SR. Tonight, I also have Dr. Carmel Cervin from SR Specialists and Referrals to help with the demonstration and answer questions. Welcome, Carmel.
Thanks, Eric.
You're welcome. Okay, just sort this out. And so tonight we're going to talk about the existing referral process, how we've collaborated with other businesses to make the e-referral process easy, why you should use SR Referral, why you're probably already live with SR Referral and how easy it is to get set up if you're not. Then I'll do a quick demonstration on SR Referrals in best practice and a look at what the specialists see when they receive an e-referral in Genie. Then a section on how we can help and an opportunity to get your questions answered. With questions, please use the Q&A button at the bottom of your screen. You can open it now and type questions as we go through the webinar. Please don't be shy with the questions. Feel free to type your questions as we go along, as there'll be a thorough discussion at the end of the demonstration. The handouts and recording will be sent to everyone after the event. So by the existing referral process, I'm talking about letters, faxes, and emails. With faxes, how do you know if the whole fax went through with all the attachments? With email, how do you know if the attachments got stripped out or if it went into the spam folder? Did it even go to the right person? Referrals that go to a practice where a specialist no longer works will mean spending extra time following up and sending it to the correct practice, or contacting and finding another specialist for the patient. Where do you find the specialist? And how do the specialists find the referrals? Is it easier to just ask the GP to refax it when the patient turns up? There's a huge amount of time spent scanning paper documents, both at GP practices and specialist practices. Attaching scanned documentation to patient information in the clinical system, following up that the referral has been received, and retyping patient information. I've had clinicians express to me their frustrations with the time spent on administration, not to mention the frustrations of the administration staff. So GPs and specialists have had secure messaging systems for years. So why no e-referrals? Well, possibly because there are multiple directories. Each hospital has its own directory. There are paper directories and online directories. There are also multiple secure messaging providers. So how do you know which one's being used by the receiving specialist? Specialists move around between hospitals and practices. GPs have multiple templates for different systems for different specialists, and out-of-date templates that need changing or just don't work. And you have to know all of this before you even start an e-referral. So the system is unworkable. It's easier to just send it by fax and deal with the fallout from that. So what have we done about it? Cervin Media have collaborated with HealthLink to provide an end-to-end solution for e-referrals called SR Specialists and Referrals. SR Specialists and Referrals is the online version of the printed directories integrated into your practice software and linked to HealthLink SmartForms to securely and seamlessly allow e-referrals. So here's Carmel to talk about Cervin Media and the collaboration with HealthLink. Over to you, Carmel.
Thank you, Eric. So Cervin Media is a family business. It was actually started by my parents 30 odd years ago. And we've been on a journey through the printed directories and now to the online service. And we're very excited to be able to support GP and specialist practices through the same journey from fax to online and e-referrals. We've kept our core business of supporting GPs and specialists all the way through, and our job is to be always updating the information so that what you see and the information you have to refer to specialists is as current as possible. The printed directories is all that content in the printed book is what you will find in the SR, and it's fully integrated into your software. It's live now. So if you're on best practice, medical director, Genie, there's nothing you need to do to be set up to access this service. As long as you're on one of those software and you have HealthLink installed, then you can use SR now. And hundreds and thousands of GPs and specialists are already receiving referrals through this service. It's actually been live in New Zealand for a few more years, since 2015, and it's the mainstay of electronic referrals for private specialists in New Zealand as well. So it's a well-proven and trusted service. So yeah, we're very excited, and we'll carry on. I'll tell about the HealthLink side now. So HealthLink is also, we've had a long-standing relationship with HealthLink, and we've worked closely together to do the collaboration to make these electronic referrals. HealthLink are providing SmartForms now, and the SR Referral is one of the versions of SmartForms. A number of you may already be using some of the other SmartForms that HealthLink have set up, such as the Fitness to Drive, My Aged Care, and some of the hospital ones. The SR SmartForm is very similar to these other SmartForms. So the look and feel and the flow of the workflow is very similar. So there's not much relearning to do. And you're going to the same place to do a very similar process. So it integrates well with your other processes. It's free for specialists to register and receive referrals through this service. So there's no cost for them to have an EDI address and to be receiving electronic referrals. And more of them are being set up all the time. So when you're in the SR, you'll see the new ones that are coming live, going from a manual, which is a referral, which is having to be sent manually. They're not yet set up electronic, to being able to do an electronic referral. Regardless, both can be done through this service. There's also a portal account for specialists that are not on compatible software. So there's no real barrier at the specialist end to be set up for electronic referrals now, which is actually quite a big game changer. And of course, it's free for both GPs to be sending these referrals and specialists to be receiving the referrals. So yeah, very exciting. And I'll hand back to Eric to tell you more about how SR works and take you through the demo. Thank you.
Thank you, Carmel. So why SR referrals? Well, we've streamlined the referral process end to end. With faxes, the GP doesn't always send the fax. I mean, typically it goes to the admin staff to manage. With SR, the GP sends the referral directly from their clinical software. The referral contains all the pertinent information on the patient that can be directly imported into the specialist software. I'll show you this in a minute. You only need to look up one directory for all specialists because it's always up to date and clearly identifies the referral pathways. There's one template for all referrals, both electronic and manually by fax. It meets the requirements for GP accreditation and EPIP, and you can provide the patient with information about the specialist on the spot in a format that suits the patient. I'll also show you this as well in a minute. For specialists, there's less printing, scanning, and data entry. The e-referral is received straight away, it's easier to find, and there is more information about the patient which can be automatically imported into their software. I'll show you how this happens. It's very easy for specialists to update their information in the directory. So as the specialists transition from manual to e-referrals, you will see the updated information in your software immediately. We'll show you in the demonstration. So how do you get set up with SR Referrals? Well, you're probably already live. And in fact, if you've got, as Carmel mentioned, if you've got best practice or medical director, you are already live with SR Referrals, and there's nothing to do but use it. I'm about to show you how, and if you need additional support and training, our contact details will be at the end of the webinar. If you have HealthLink and other software, and your software is compatible with HealthLink SmartForms, then you can still receive e-referrals and send via secure messaging. In this case, you can contact us for support and training. If you don't have HealthLink, you can register for a free HealthLink EDI address directly from their website. If you are on compatible software, then HealthLink will remote in to set up your messaging. And if you're not on compatible software, then you can be set up with a portal account. So let's see how easy it is to use SR. I'm going to demonstrate how to find the SR smart form in best practice, how to navigate the directory and find the specialist you want, and how to create and send the referral or park it while you wait for results. Also, what the referral looks like when they arrive with the specialist, linking the referrals to an existing patient and creating a new patient from the referral. So let's get into it. I'll just change across to best practice. Which I thought would be really easy. And there we go. So I've got a test patient open at the moment. And as you can see, Mr. Test Patient, we can look at we can look at the referrals that he's done before by going into View, HealthLink Forms. Just wait for that to load up. Everything's running a bit slower. And here we have the HealthLink forms. And what I'm going to do here is open a new form. Which hopefully will eventually turn up. If it doesn't turn up in a second, I'll use the portal. There we go. So you can see this is the typical smart form starting page, and there's the typical referred services. These are some of the ones in Sydney. And what we're going to do is click on specialists and referrals for private specialist referrals. And that should bring up the database. I've done this many times today and it hasn't done this. There we go. So the first thing we can look at here, we can see that at the top here, we've got our search fields, and we can see that this is the medical specialist directory that has been made electronic in here. And if we scroll down a bit, we can see the recently profiled specialists, but also to learn more, we can see that there's a quick SR guide video that you can watch at your leisure. And further down is our contact details for support. So that's always in front of you in your software. If we go back up to the specialist, we can, if we know the name of our specialist, we can search it straight away. So I'm just going to put one in here. So there's Tuck. Let's go for general surgery, Tuck Young, and search. And as you can see, we've got a simple photograph of the specialist, his areas of interest, the languages, etc., what service he's provided, the credentials, his contact information, and there's also a map of the places where he works down in Melbourne. So what we can do here is we can do an e-referral to him at each of those locations. But I'm not going to do that just yet. I'll just go back and do a search for, let's try a category. So if we don't know who we're looking for, we can go, for instance, cardiology related in Sydney. So I'll just type in the postcode for Sydney and then choose from the drop down and search for specialists. And then, as you can see here, we've got 19 results for cardiology in Sydney. And there's profiles with photos and information on them come up at the top. And then there's other standard basic ones further down. So the other thing we can do, I'll just go back, is we can look at sub headings. So for instance, if I'm looking for general surgery, but I'm actually after a skin cancer specialist, I can scroll down, and on the left here, we can see under general surgery, there is skin cancer.
You can also pop out your window a little bit larger so you can see more at once.
Yes. You mean if I drop this down?
Yep.
Thank you. And so we get quite a few results for skin cancer, 22 results here. And let's say I'm looking through and the one that I want is this one at the top here, Dr. Mayer. And I want to see what else he does. So I click on his profile and I can see that there's a lot of things that he does, as well as in services and where he is. And at this point, if I like, I can email this information to the patient. So over here on the right, you can see email patient. So I can click on that and I can enter the patient's email address. In this case, I'm going to put my own one in and send the email. Now, it's important to note that the email is not coming from you, it's coming from us. So you're not necessarily, or you're definitely not exposing your email address to a patient. And this is what the email looks like when it turns up. And you can see that it's giving you the listing on Oz Health pages. So your GP has sent you a profile and contact details of this specialist, and it's on Oz Health pages. To view that, you can click here to view it, and that will then bring up Mr. Amaji's profile on Oz Health pages, which I can also show you. Here we go. and that's his entry on Oz Health pages. And Oz Health pages are available for you as well as patients to search for specialists.
It's the public version of the same database, so that patients can also see information about the specialists they're being referred to.
Okay, so if I now go back, because the system is live, I'm not going to send a e-referral to a specialist. So we have got some test specialists in here. So we have one here called EAR, earlobe, who is, how do you pronounce that, Carmel?
Otolaryngology. I'm sure lots of GPs are familiar with this one too, or ENT.
So if I search for that specialist, he comes up, and what I can do is I do an e-referral to him. So in this case, I can do an e-referral or a manual referral. I'm going to start by doing an e-referral. And wait for the form to load.
Yep. Anyone's welcome to use these test ones. We also have Mickey Mouse to do a test referral too. So we use them quite regularly, and they get lots of referrals, and it's great to be able to do a practice just to get familiar with how it works.
I'm really amazed at how slow this is running. Normally it's very fast.
So the next stage is it's loading the HealthLink SmartForm. And this is the piece that HealthLink are providing of the service. So the first part was the directory piece, and now we're into the HealthLink SmartForm.
So this is the HealthLink SmartForm, and it is automatically populated from the clinical software. There are items with a red asterisk next to them that need to be filled out for you to be able to send it. So the first thing that has to go in is the reason for the patient referral. You can either type directly into this, or you can browse for your consultation notes. So in this instance, I'm going to browse for some consultation notes. But maybe, oh, there we go. And attach them. And then I worked through these tabs on the left. So the ones with the exclamation marks are the only ones that are needed, or should I say don't have information in them yet that is absolutely required for it to go. But I can still do other things like attach reports. So in this instance, I've got an X-ray, I've got another referral that I did earlier, so I can add that if I want. I can, there are no allergies here. There's also the medical, social and family history. And actually, if I go back there, I'll add the ones about ear pain. And the patient information. In this case, I've got a Medicare number in there, so that's required. And then as we get to the end, there's the referrer information. Now, what I can do is I can submit this now, or I can preview it, or I can park it. And one of the reasons for parking it might be that I'm waiting for more information to come in before I send the referral off. In this case, because it's running so slow at the moment, I don't think I'll preview it. I'll just submit it, and then it will process it. And submit. It succeeded to submit it. And there it is. At this point, if I want to, I can print this. Now you can see that this is the referral, but there are no attachments here. So we need to see it at the other end. to see what the referral looks like when it's received?
It references the attachments. It says what they are, but you can't actually see them in this version at the moment. But that's an improvement which HealthLink are working on at the moment.
So I'll just close that, and then it comes up in the list. And as you can see here, I did one earlier, which was a manual referral. And this one works in exactly the same way, except that I can't put any attachments on it as yet, and that's coming soon. And it always comes up as print fax in the list.
The referral itself actually tells you that it's a manual one and that it needs to be printed off or faxed or sent manually.
So let's see what that looks like when it comes out the other end. So I'm just logging into the portal so we can have a look at it. So I have one here. There it is. It was sent at 1926 local time. And if I open that, we can see here is the whole referral, including all the attachments and the X-ray. So I don't know why X-rayed his hands when it was an ear problem. Okay.
You can, I was just going to say, you can also choose attachments from your desktop as well as from within the patient record. There's an option for that.
Thank you. Yes, I missed that bit. So let's just have a quick look at what the specialist sees. So this is Jeannie, and I've sent some referrals here earlier. And there's two in particular that I want to have a look at. So this one here is Amanda Greenslade, and Amanda was already a patient here, and she has, this referral has been linked to her record in the Genie system here. So there's one. Then I think it's Frederick Ford. No, that one's been done as well. This one. So this one hasn't been linked. And so same with the next one. So this one here, see these 4 red equal signs? That means that that Jeannie can't find a matching patient for this referral. So what we can do is we can create a new patient in the system and populate it with data from the referral. So I'll just go on new, and there we go, it's done. Mr. Test Patient, and with the address and all the pertinent information in there, age, etc. So this saves a whole lot of data entry for the specialist. So I just click on save. And then now that I have that, I can link or unlink this referral to that patient record. And because I've now got 4 equal signs, I'll just link it. And it says here, linked by doctor. And then I can close it. And that in this list here, it's showing me all the unlinked ones. And if I go linked, it'll then turn up in the linked one, which was down the bottom there. Have I missed anything there, Carmel?
I was just going to say it's very common for a lot of specialists to be on this software. And so it's very helpful for them to be getting these referrals through electronically and taking away a lot of manual data entry of patient information when they can just either link it or create a new patient straight from the referral. So they really like receiving referrals through this method. And we're also actively providing training to specialists as they've received their first referrals through the service, so that they know exactly how simple the process is, and yeah, any extra support we're able to assist them with that.
So that's about the end of the demonstration. Have I missed anything, Carl? Just making sure.
You could go back and just do a manual referral to show people what the difference is. I think that's quite a good idea.
So there's so if I just want to go straight in and do a manual referral, I can just hit the new HealthLink form, this button up the top, and bring that across. Go into SR Referrals SmartForm, enter a specialist name. I'll do earlobe again. Search for the specialist. Do a manual referral.
Just over on earlobe itself, yeah. So because a manual referral isn't actually sent electronically, you can, of course, practice a manual referral on a real specialist as well. But you'd want to use a dummy patient record to do that, obviously.
And the same thing, it's picked up all the information. I just need a reason for the patient referral. And I'll just put some information in there. The rest is just the same. The patient information is in there, as is my referrer. So now I'm complete. I can just print it. I can also preview it or park it, same thing. So if I want to park it and while I'm waiting for some laboratory results, for instance, or x-rays, but in the meantime, I'll just print it. Now that it's printed,
so it very clearly says on the referral itself, you'll see it when it opens, that it hasn't been sent electronically.
it's just opening, and there it is. This referral is to be printed and sent by fax or mail.
Yeah. And on the bottom of the referral, it actually gives the recipient information to say that they can be set up for electronic also. And we are adding specialists all the time who realise that this will be useful for them. The other thing that we could show people, Eric, is the list of the status of the referrals. So just closing out of the patient record and then going into HealthLink. So if you do it within a patient record, you'll see the list of referrals just for that patient. But if you close out of the patient record and go view HealthLink forms, you'll see all of the referrals that have been sent. And you can check for the status of them in terms of whether they've been acknowledged or awaiting acknowledgement. So there's HealthLink forms there. There's also e-referrals above that as well. So this view will show you any that are part, and you can open them up, I think, as well, or go back to the patient record to see them. So you can see this, where you've got to in different, with processing different referrals. Sometimes if you're sending quite a few, it might be a good idea to check occasionally in case you've parked one and forgotten to send it. Obviously, you want to make sure you send them all through. So it's very easy to go back and just check on the status of those referrals. We also monitor the referrals going through. We can't see any patient information in the logs at the SR end at all, but we can see if there's any errors with a referral not being received by a specialist, and then HealthLink actively follow those up as well to make sure that the EDI or any settings at the specialist end that need to be adjusted are. So yeah, there's ongoing monitoring of what's happening of the service as well. So that's just handy to know, to see that overview, especially if staff have gone on leave or anything like that as well. It's a good place to check.
Okay, so shall we go on with the presentation?
Yep.
Okay, I'll just get back to the other screen. So as Carmel mentioned, we provide extensive free training for your staff and are happy to contact the specialists you refer to so they can use SR as well. So whatever their workflow, we can help them integrate SR so you can both reap the benefits of electronic referrals that work. Our sole purpose is to help GPs and specialists, and we've been doing it for 30 years. We're sensitive to your requirements and admin processes, and our tools will make your life easier. Feel free to call or email us with inquiries or for training. Let us know if you have particular specialist practices that you would like to see shift from faxes to e-referrals. Let us know and we can contact them and offer setup, support and training. Because the system is live, it updates instantly. So if a specialist joins or leaves a clinic, if they change their contact details, if they add or remove consult locations, or if they're doing telehealth consults, as soon as we know, you know. And finally, we help specialists by providing basic entries in the directory for free. Specialists can improve the visibility of their entries by including information on their services, their photo, and be listed under multiple categories. Paid entries are annual and a package entry in the medical specialists directory, SR and ozhealthpages.com.au are all included. There is no charge for GPs to use this service. So, thank you for your time. I'll hand back to Brad and see if there's any questions.
Oh, thank you so much, Eric and Carmel. It was really informative. And we do actually have quite a few questions waiting for you as well. So I'll just make my way through them. So the first is, what is the difference between HealthLink and SR?
Shall I pick that one up?
Okay,
Yep.
You go for it.
So HealthLink is a messaging service. So their core business is to send electronic communications securely and between different health providers. So essentially the way that information should be exchanged instead of via email electronically. There are other messaging services, but HealthLink have been around for quite a while and they have a very extensive footprint both across GPs and specialists. And there is no cost for specialists to be set up with a HealthLink EDI to receive SR referrals. It's up to the specialist to choose whether what messaging service they want to reply back with. And obviously it's quite common for them to be set up with more than one messaging service. SR is obviously the directory side of the service. So that's our business that we've been providing for many years. And it's really the collaboration of our two tools together, which is making this work for you. So SR gives you the up-to-date specialist information. We do the background legwork of linking each individual specialist address to the correct HealthLink EDI so that the referral is delivered to the correct location. And that obviously is changing all the time, and we work very closely with HealthLink to maintain that information for you. So it means you no longer have to update EDIs in your local address books because that's all taken care of by SR. And that's actually a big time saver in the admin side for many practices. So hopefully I've answered that question clearly enough, but feel free to come back with any more details on that.
Perfect, thanks, Carmel. So the next question states, what if the patient later says that he or she wants to see a different specialist than the one we have sent the referral to?
Can you take that, Kamal?
Yep, sure. That's quite a common scenario. Often patients do look around a little bit because there can be quite extensive wait times for specialists. I think one of the beauties of SR is that it's actually quite a quick and simple process to do the referral. So it is best to regenerate that referral so that you pick up the details of the new specialist that they're asking to be referred to. And all the information is still there. You can obviously copy and paste from, bring across your consult notes easily. And by doing the new version, at least then you're keeping up to date with any information that may have changed in the patient record since you last did the referral. So hopefully that process, as you become more accustomed to how to click through the form, becomes easier as well. But it is best to not click on an existing referral, but to do a fresh referral so that the information is clear and clean at the specialist receiving end as well. Yep.
So if a patient comes back and says, I want to see this particular specialist, it's also easy for you to look that specialist up inside your clinical software rather than have to go to a paper directory or some hospital directory or something like that. It's all there for you. So you can look the specialist up and then redo the referral very quickly.
Yeah.
Perfect. Thank you both. So the next question says, I have used the HealthLink referral system, but for some reason the XR reports shows up in the list, but does not have a button to be enabled to be included in the referral. Is there any way to overcome that?
That's a question that we'll take back to HealthLink. So I'd be quite keen if you have an example of what the XR report is exactly, or the scenario that's in. Any further detail on that would be quite helpful when I go back to HealthLink and just check what's happening there. We do have
X-ray.
I think XR stands for X-ray. Sorry, I'm just assuming that.
You should be able to, but I will definitely, I'll definitely check that out. Yeah, as far I'm not aware of an issue with that. So if there are limitations on the file size of some attachments, so whether it's something to do with the size that the X-rays come in at, yeah, it'd be good to just dig into that a little bit more detail so that we can help resolve that. I'd be very keen to get that resolved.
And just to touch on that, Carmel, as well, I think it does specify on the referrals about which file types as well. So maybe just check what type is coming through for the X-ray report.
Yeah.
Thank you. So the next question mentions, can we use this service to send a letter, not just a referral?
It will be headed as a referral. So I think if you were to send it as a letter, it may cause some confusion at the specialist end. Yeah, that would be my suggestion on that. It is possible, specialists are able to on-refer with the service because the specialists using Genie also and the portal also have access to sending through this service. They can on-send a patient as a new referral to another specialist if they need to. But the intent of it is to work as a referral, and then if the specialist wishes to reply back in the letter format to the GP, they can do that separately from the SR tool.
Perfect, thank you. So the next question states, is this service only for private specialists?
No, public and private. Is that right?
Some specialists do provide public and private, and so where that's the case, it's a good idea for them to make very clear on their locations if any of those locations for consults are public rather than private. And then it's really up to the triaging at the specialist end where they receive the referrals. If they're managing both public and private referrals at the one consult location, then internally they need to be quite clear about that. As a general rule, it's intended to be primarily for private referrals, and it's not set up to replace referrals going through to public hospitals. So in that context, there's likely to be other criteria that need to be met for referrals. And you'll notice because it's one generic referral form for all these referrals, it's not being tailored to different criteria that might be in place at particular hospitals. So it is designed to be used primarily for private referrals. Yeah.
Perfect. Thanks, Carmel. So the next question asks, why would we use this method for manual referrals?
Okay, so if you are doing a manual referral in another fashion, so you using a letter, for instance, you aren't necessarily getting it auto-populated from the clinical software, but also if you're doing a manual referral to a specialist and they decide that they would like to receive an electronic referral, you won't know that unless you're using this system, or they specifically tell you to. So because you can do manual referrals in here as well as electronic referrals, it's a one-stop shop. You can just go to one place and do them all.
It's also quite common for specialists to have, because they're at multiple locations, to have some of their locations electronic and some of their locations manual. So you can see on that drop down, when you choose a particular location, whether that referral is going to go electronically or at a different location manually. And that really depends on the software that's being used at each location and whether they've got EDI set up yet at that location. So there's a granular level of information that is visible through this service that you may not know about if you're just doing it manually the old way. And obviously the information is being updated all the time. So if they've added a new consult location that you didn't know about, you'll see that through this service and you wouldn't have known about it if you carried on doing your manual referrals.
Perfect, thank you. So the next question says, if a specialist is not in the search directory, does that mean he or she is not set up on SR?
Do you want to get that, Carmel?
Yep. Guessing, do you mean by search directory that when you go into SR you can't find them, or so we do include everyone that we know about at the time we do the printed directory, but obviously that's a snapshot in time. Throughout the year, we're adding new specialists all the time to the online directory. There is no barrier for specialists to be included in the online directory. So there's no cost. We simply need to know to add them in. We're constantly in touch with specialist centres and finding out about new specialists. But if you know of one and that we haven't heard of yet, by all means, flick us an email through and letting us know there's a new specialist here or there, or any sort of leads or details for us to give them a bell or email. We're very keen to find out about new specialists and we love getting them set up. So our goal is to have as many specialists live all the time for you. Sometimes specialists are retiring or have closed their books. For those specialists, what we are endeavouring to do is to still enable them to be found in SR for a period of time. And we're starting to introduce a message. So we turn off the e-refer button because they've said, no, can't take any more referrals. But we do display their name with a message that says, you know, retiring or their books have closed, so that you know that they're not missing from our system, but there's actually a reason why you can't refer to them now. So that's also an important part of the tool that will continue to develop over time as we hear more from specialists where that situation arises. And sometimes they go on sabbatical, and if they're really onto it, they tell us and we turn them off for a little bit, and then when they come back, we can turn them back on as well. So more than happy to be providing that aspect to the service, because it makes it easier for you to know who you can refer to now and what's happened to other specialists.
Perfect, thanks so much. So the next question says, what if the specialist is not on Genie? So I can imagine that's because the demonstration showed the other end using Genie software. So maybe just expand on that.
Yeah, so if they're not on Genie, there is other software that will receive SR referrals. So if they've have HealthLink set up and the software is compatible, then HealthLink will allow it to be received. But if they don't have Genie or compatible software, then we can provide them with the portal account. So they can still receive it as long as they have a computer and an internet connection.
Yep. So yeah, the portal account sees the referral come through just through a browser login and can be picked up anywhere, anytime. And the specialist receives an email notification telling them when they've got a new referral for those accounts. That's how that works. I thought of something. Oh, in terms of the other software, the additional software is being set up all the time to be added to the SmartForms suite for HealthLink as well. So if at some point the software isn't yet live, as soon as that does go live for HealthLink SmartForms, we will be turning on those EDIs. A few of you may be using HealthLink's AUPD directory, may have a log on to that where you can see all the EDIs and clinics under those. Occasionally, there'll be a clinic on there with an EDI who we have turned off. And that will either be because the software is not yet compatible for the HealthLink SmartForm, which is a newer technology.
When you say turned off, you just mean manual
referral, yeah. So they'll still be found in the database, but you'll be expecting to send the referral electronically, but it will be manual on that location. We would love, obviously, to get them electronic, and as soon as that technology is compatible, we'll be switching them over. The other thing is occasionally we run into a specialist site where they've specifically requested not to receive electronic referrals. If you find that there's a site where you think they should be and they aren't yet, by all means call us and let us know. And we're always looking to encourage more specialists that are a little bit reticent to give it a go. Sometimes what we do is just turn it on for a trial period so that they can see how it works and get a bit more comfortable. Sometimes it's a training issue. Maybe they've got staff turnover and they're not quite ready. So it's really a case of us working closely at both the GP and specialist end to navigate through this transition and do it in a way which people can trust and have confidence in, that the referral's definitely going to get there. Because we're monitoring the delivery of those referrals, that's how we know, if we find that they're not being managed at the specialist end, that's when we go back and actually turn off the e-refer button for now and leave it as manual until they're ready at that site to be managing those referrals. So yeah, as soon as we can, we'll turn them back on. We're always keen to do that. And even as the more referrals they see coming through manually, that also tells specialists, perhaps we should be set up now for electronic. It's going to be easier. We're getting more and more of these instead of by fax. It's another clue to the specialists that there is a movement happening, and that it would be a good idea for them to get set up as well.
Perfect. Thank you so much. And the next question is asking, is medical objects like HealthLink, as they've heard colleagues interstate speak of this service?
In a way it is. So both HealthLink and medical objects are secure messaging vendors. So you can send and receive, and there are two others, ReferralNet and Argus. So there's other ones out there that are secure messaging services. But SR works with HealthLink because HealthLink are providing the SmartForms.
Perfect. And I think that's all for now, unless anyone else has any other questions to add. This is your last chance to put them in the chat.
Looks like we might finish on time.
I'll just mention we had one other question that I answered early on, which was just asking what SR stood for. and SR stands for specialists and referrals. So we were trying to make it simple. Yeah, so that was the only other thing that popped up earlier on. Just sort of mention that in case anyone else was wondering.
And I've also mentioned this other query as well, Carmel. I think a few practices mentioned they've noticed urgent and telehealth on the SmartForms lately. Would you be able to elaborate on that a little bit as well?
So the urgent referrals banner is where specialists have specifically told us that they do keep appointments aside for seeing patients urgently. So it isn't giving you the exact time slot of those urgent appointments, but it's an indicator that yes, the specialist is prepared to see patients urgently and will make time for them. So that's quite helpful when you're looking for a specialist, and you can refine your search by that. And likewise, the telehealth banner is similar. It's not designed to actually enable you to do telehealth through SR, but it's again an indicator to say, yes, this specialist or this service provides consultations or provides their services by telehealth. There's a number of areas where that's becoming more common, particularly in pediatric and psychiatry, and obviously it's moving with the time, so more specialists are now open to providing their services by telehealth. And again, it's quite helpful to be able to flag that so that you and your patients can help identify where those services are available by telehealth.
Perfect. Oh, thank you so much. Appreciate that. So yeah, that brings us to the end of the webinar. So thank you so much for everyone who's managed to attend, and thank you so much to our speakers. Just some reminders, Saffron SB has been released, so do refer to Best Practices website and ahead of your update. And remember to follow all of the urgent prerequisite steps. For any My Health Record, HealthLink or setup support you need, please do contact the digital health team at the PHN. And please remember to complete the evaluation survey that will pop up on your screen shortly after the meeting. So thank you so much, Carmel, and thank you, Eric.
Thank you.
And I think you mentioned if anyone needs to contact you, to contact the support team as well. At your end.
So they can contact us directly through the email address that's on the screen or the phone number. And of course, these slides will come out probably on Monday with all of our contact details in there.
Perfect. All right. Thank you so much for your time, everyone. Take care.
Thank you.